interested in going into medicine professionally? I'm seeing a lot of hands. Are you guys interested in going into surgery by chance, or just any type of like nursing or whatnot? Can you guys possibly describe to me what a surgery room looks like nowadays?
Well, a lot of technology, devices.
Yeah, a lot of technology, a lot of devices. In fact, it's so digitized that even anesthesiology machines, the things that they use to knock you out and keep you at a steady breathing rate, are actually done digitally now. They can actually download the software and have it changed, adjusted to your body temperature and whatnot. It's no longer hand cranked like the one that's in my office. What else?
Sterile.
It is very sterile. It's so sterile. Everything that you do is, everything you wear is washed. You can't even wear your wedding ring on your hand. You have to wear it around your neck. And you're constantly scrubbing and cleaning. Unfortunately, because we're going to be transported back to 1847 Chicago, she's not going to have any of that. And on that note, I need more volunteers. Okay, and I saw you getting pushed forward, so why don't you go back?
Karma.
These are my two assisting surgeons.
Wow.
So we've got two choices here. Unfortunately, we don't have LinkedIn or academia.edu. We've got these to show us who the better surgeons are. Which one do you think is the better surgeon? And it's so funny.
Left.
Your left.
You're left. Yeah, you're left. Oh wait, no, you're right. You're right. You're right.
Okay. To the left, to the left. Sorry. For those of you who said this one, why?
More blood.
More blood meaning what? Like
More
surgery.
more
surgeries.
surgery, more work. And what about this one?
Less death.
Less death. Yeah. This guy's probably a lot more clean. Probably isn't hacking and hawing. But back in the day, if she had the choice of the two different surgeons, she would pick this one, simply because, as you pointed out, yes, it's because they've been working the entire day, they're so busy, and here you go. So these are my assisting surgeons. Now, yes, you are, my dear. So she was just happened to be walking down the streets of 1847 Chicago, and her boot got stuck in a cobblestone and snapped it, and her leg's sticking out, and it's awful. So amputation. Nowadays we'd probably call the ER, and she'd get an ambulance and whatnot, all that boring stuff. But nope, not today. She's gonna have it amputated. The first thing we're gonna do is we're going to use this thing. And it's not a belt. A lot of people think it's a belt. How many of you are in Scouts by chance, or were in Scouts? Have you studied tourniquets at all?
In phlebotomy.
Oh, you have? Oh, perfect. So you'll know exactly what it's... Why do you need to use a tourniquet in phlebotomy?
Well,
Come closer. Oh my God.
For the blood pressure.
Yeah, blood pressure. So what do you think? Why am I going to want to clamp off her leg right before I attempt to cut it off?
so the blood doesn't just go.
Exactly. What's the name of the... Do you know the name of the artery that runs through the leg? Yes. That is one of the biggest arteries in your body, and it will, that's the big one that if you're in an accident or whatnot, it'll gush out. There was a really horrifying thing on Reddit recently of a young lady who was in a car accident and she lost her leg, and the first thing they had to do was tourniquet her leg. So, surgeons, don't be shy. So I need you to hold that down, and you're going to be the anesthesiologist. And what do you think that means in 1847 Chicago?
Knock him out.
Knock you out? She's going to hold you down. Because anesthesiology wasn't really perfect at this time. When you go upstairs into our pain eradication exhibit, you're going to see that people throughout surgery have been using all sorts of things to knock people out during surgery. At this point, maybe if she was super lucky, she'd get a lot of alcohol and a crack to the head. I'm not even being funny when I say that, like literally, that was what it was done. By the Civil War, other drugs such as cocaine were starting to be explored. In fact, cocaine actually started as an eye wash of all things. And then it also started being used for facial reconstruction and other parts of surgery, as well as other drugs that are now illegal. In fact, heroin was actually used for a while because it was considered less addictive than morphine, which is creepily enough still used. So enough of that, let's get to the cutting. So the first thing we're going to use is just a simple saw that is a simple hand saw. It kind of looks like I stole it from Outback Steakhouse, and it's got a very similar attitude to it as well. So the first part I'm going to do is I'm going to cut through her skin. And she's got a lot of hand motions. This is good though, there's no screams yet. The screams are going to start very soon. The next thing we're going to do now that we've cut through her skin is get through her muscles. And we're going to use this. It is very long, it is very sharp, it is very pointy. And so now I'm going to go here, I'm going to pop out her tendons, pop out her muscles. If she's lucky, she'll have passed out. Everything's good in the hood. Now, figuratively speaking, of course. Now we're going to use the big one. This is a big bone saw. And a lot of times students ask me, people don't use this anymore. The truth of the matter is if you're in orthopedics, and you're going to see this in our orthopedics exhibit upstairs on the 4th floor, the tools haven't terribly changed that much when it comes to bones and to removing of arteries. They're still somewhat primitive looking. The difference though is that you're under, it's a lot more sterile, and orthopedic surgeons have a lot more training. Oh, I forgot, I got to saw your leg off. Saw. And if I'm very, very good and she's lucky, this entire operation plop, I'll sew it up here, maybe lick it a few times for good luck, and boom, you're good! Yay, I see you! So what do you think her rate of surviving this operation is going to be?
10%.
About 50%, not too bad, right? Well, what are some reasons that she'd die after this operation?
Infection.
Blood loss is a really big one, especially if we're doing it near the femoral artery. Infections, what kind of infections?
Bacterial.
Yeah. Things like septicemia, which actually still kills people to this day. Do you guys know the singer Lily Allen? She actually got septicemia after a miscarriage. So septicemia can still happen if you receive an infection or just have an opening where bacteria can get into your bloodstream. Septicemia is basically infection of your blood. And from there it can go right into your heart or other parts of your body, other crucial organs. Can I have the aprons back, please? Other infections are gangrene. Even though we may have cut off that part of the body, perhaps if somebody had gangrene on it, she could have contracted that well. In fact, one of the most famous physicians of this time period, Robert Lister, bragged about how he could easily perform an amputation in 30 seconds or less. In fact, his bragging right was "gentleman, time me." However, he's the only physician to have a 300% mortality rate in his office. The reason being, he was supposed to cut off a young man's leg. Whilst cutting off his leg, he went so fast that he cut off his assisting surgeon's fingers. His knife was going so fast that an elderly physician who was attending him passed out and had a heart attack and died. And both the patient and the assisting surgeon both died of gangrene. Yeah, at that point it's like you give up being a doctor and go become a painter or something like that. No, but that was a common thing, and your guys are going to see that, and because you don't have a lot of time, I'm going to let you now explore. Thank you guys so much for coming up. Feel free to hobble throughout the museum. They just fixed our elevator today. Hooray! So, do you have any questions?